Did you know a mistranslated word could cost your life in the ER? Picture this. You're a traveler and you tell your symptoms to Google Translate. And instead of chest pain, the doctor reads chest sadness. Seconds matter and lives hang in the balance. Hi, I'm Teresa Youngkin. I'm a health informaticist and I've trained executives. I've led AI pilots, worked implementing smart on fire applications, and worked on data governance. Today, I'm going to pull back the curtain on why everyday translation apps like Google Translate might be the riskiest tool in a medical crisis. I go to Mexico, I have a great time, I go to this amazing meal. The next morning, I wake up, look in the mirror, and my lips are 3 times the size, swelling, like getting to the point where they felt like they wanted to burst. I quickly found some Benadryl, and then my husband and I jumped into a cab while our friend, an ED doc, followed language barrier. That's huge. The problem wasn't just Spanish versus English. It's the medical terminology that has layers, clinical terms, patient-friendly terms, and emergency terms. Most think translation is swapping words between languages. But medical translation, I'm going to tell you something that is a different beast. You're not just converting dolor to pain, you're preserving clinical accuracy, cultural context, and critical nuances. There's a huge difference between a commercial AI translation and medical AI translation. Google Translate has been trained on websites, social media, and general text. Whereas medical AI tools are trained on clinical literature and validated by healthcare professionals. It's like using a regular dictionary versus a medical dictionary. You could have similar concepts and completely different accuracy when it comes to healthcare. And this is what can happen if your medical translation goes wrong. Intoxicado in Spanish means food poisoning. But when you put that into Google Translate, you get the word intoxicated. You've got food poisoning versus drug overdose. Number 2, me duele means it hurts. But Google Translate may not know the word for crushing chest pain. The AI will hear stomach pain instead of potential heart attack. Third thing, medical abbreviations. SOB in English is shortness of breath when you see it in medical notes. But if you translate that literally, you get a completely different message. In 2024, a semantic review in the Annals of Translational Medicine found Google Translate accuracy ranges from 36 to 76% to English and 83 to 97% when it's translating from English. Here's the kicker. Accuracy varies by language. Spanish and Chinese hit about 90%, French 85%, Korean starts to drop to 80%, and some languages like Armenian plummets to just under 55%. A separate study of emergency discharge instructions found that while Google Translate averaged about 82% accuracy, that still means that nearly 1 in 5 critical medical instructions contained errors. One mistranslation can be life-threatening. The issue is not AI. It's that we're using consumer tools for critical situations. As someone who's put together and implemented AI, here's what is going to actually work. You're going to need a 3-layer translation protocol. That first layer is going to be your medical context recognition. You use Claude or GPT with medical prompting. So you're going to say, translate as a healthcare professional speaking to another healthcare professional. You want to include symptoms, not just words. The patient's experiencing, list out the symptoms, shortness of breath, swelling of lips, and then write needs translation for, and then put in that specific medical context. The next layer that comes after that is the verification loop. Never rely on one translation. Translate back to the original language to make sure that you've got it right. Cross-check with professional medical dictionaries. You can use Stedman's or Medline Plus, the medical encyclopedia. There are professional medical dictionaries you have access to. Finally, that third layer is human validation. So you want to find medical professionals who speak both languages and have them read it. Key is, and I know this from working in community-based organizations, if I have a person from Mexico reading something in Spanish and somebody from Panama reading Spanish, they may not translate exactly the same. So you're going to need somebody who speaks both languages, and it's even better if you can get them in both dialects. If you don't have somebody on staff, then use your telemedicine translation service. And finally, know if you're traveling internationally, know your embassy or consulate medical contacts before you travel. Nobody thinks about it, but I know people who've had their ankles broken while riding a bike in Ireland. I woke up with lips 3 times the size, having a reaction to something I ate. If you are in an emergency situation, you can say, I'm experiencing, put in specific symptoms. Translate this into medical Spanish or French, whatever language you need it translated to, suitable for emergency room staff. Include both technical terms and patient-friendly explanations. Verify accuracy for life-threatening situations. Translate these medication instructions into whatever language you need, preserving exact dosing information and critical warnings. Format for patient understanding while maintaining medical precision. Healthcare professionals working in IT, like me, fire terminology servers can help with standardized medical translations. There's an evidence-based medicine group if you didn't know that. HL7 has international terminology guidelines. Use them. Consider cultural context. I'm sure a lot of people don't know that pain scales can vary between cultures. If you're a traveler and you're getting ready to go out, I want you to pre-translate your medical history and allergies before you leave on your trip. You can download offline medical translation apps. There's Care to Translate, that's in 47 languages. Say Hi to Medical, that's got 100 plus, it's HIPAA compliant. Also, always carry written translations of critical medical terms in your local language. If you're a developer, understand medical translation needs different AI models. Consider implementing medical entity recognition. HIPAA compliance matters even for translation tools. Here's what you can do. Create your personal translation kit. List your allergies, medications, and medical conditions. Get them professionally translated. Don't rely on Google Translate. Save both a voice recording and a written version, and then test them with a native speaker. This isn't just for international travel. This matters in our own communities where we have non-English speaking patients, we've got elderly relatives, or we've got emergency situations. I know I have family members that visit from out of country who don't speak English well. It's right here in our communities. If you had a magic AI translator, what feature would you want it to have for medical emergencies? Put it in the comments. Dream big. This is for developers to look at and start creating. Next week, we're going to be talking about how AI understands the meaning behind your searches. We call that semantic search, and why that is changing finding the right information online, especially in this age of agents. Subscribe, ring the bell so that you can get more healthcare AI insights that actually matter. All right, guys, I catch you on the flip side.